Hey guys, welcome back to Nursing School TV. So in this video, I want to talk about what my second week of nursing school was like. So last week I kind of went over a little bit, and this week go over a little bit more. It's been a hectic 2 weeks, that's for sure. I don't think I've slept less, studied more, worked harder, maybe had a couple breakdowns in between. It's been kind of stressful. We actually have our first test on Thursday of this upcoming week. So that's really kind of scary. I haven't discussed with you guys in our program. We actually have to pass with a 75%, not a 74.99, 75%. So it's important to do well on the test to at least pass the class. And then, so we as a class have kind of been stressing about that, because it's not like, oh, is this true or is this false? It's NCLEX style questions. They are really pushing that. That way, when we do take the NCLEX, it is easier for us because we're used to those type of questions. So, okay, so this week we did lecture on Monday, which we talked about the physical head-to-toe assessment. So basically we just went down the breakdown of what a physical head-to-toe assessment is. It sounds like just what it is. You know, we check from head to toe of a patient, and we basically mostly talked about normal. That way, if there was anything that was abnormal, we could kind of see the difference and all that. So that was really kind of fun. So then Tuesday we went to the clinical, our little skills lab, and we practiced our head-to-toe assessments. We went over everything slowly by slowly. We also did restraints that day, so that was kind of neat. Once we figured out, you know, okay, this is a head-to-toe assessment, and then this is, you know, what needs to be done. It was really kind of neat. One of those peer reviews we do with our peers, and then this one was also what our professor reviews and marks us off on. So she would like throw little stuff in there. We'd have a classmate sit down in the bed, and we'd start, you know, come on over, ask them how they're doing, introduce ourselves, make, you know, ID them by 2 identifications, and then basically we would ask you, how's your pain, you know, and our professor would be like, oh, it's this, and then so through the head-to-toe assessment, you listen, you feel, you touch, you look, you do a whole pretty much workup of a patient. And so she basically, when we would listen to the lung sounds, she would make these like coughing noises or little gurgling noises and stuff like that. And so those were our little cues to kind of pick up on that, to probe a little more, to find out, you know, is this something that's new? Has this been going on? How long has it been going on? Stuff like that. And then also at the end of it, she'd be like, you know, if we did nothing, like say she coughed, actually, you know, one girl, she just kept going on with the thing, you know, it's a teaching moment. The professor goes, what could you have done? You know, you want to sit them up more, you know, stuff like that. Give them a little time to maybe cough it out. So that was Tuesday. And then, like I said, we did the restraints. So we got to try the restraints on and learn all about kind of what entails that. Wednesday, we actually did, or I'm sorry, Wednesday we did medication administration. Now that is probably the scariest thing. I think that I personally was the most nervous for, because this to test for, because that was also what was done with the professor. And basically, you know, you have to know the 6 rights, which is basically right patient, right medication, right dosage, right route, right time, and then right documentation. And in our program, we do I'm sure everybody else does, we do a 3-check method. You know, when you're pulling the meds out of the cart or whatever dispensary, you check them to the MAR, and you make sure that they are there, that they're good, and that's check 1. Then check 2 is outside the patient room, you double check them again. And then the 3rd check is at the computer when you're actually scanning them into the system. Well, in our program, we actually, anytime we administer medication, we have to do it with our instructors. They do have to be there, but we have to call them over at our 2nd check. And if we don't do that right, there's like a remedial action with the dean of the program. So it's kind of really scary, because you get the 1 check with yourself, and then when you call her over, that better be the final right, and it better be done correctly, or else you get in trouble, which I can't blame them, because I mean, if you give the wrong medication, you could kill somebody. So that was, like I said, the most nerve-wracking I think I was in testing, because she set us up in this little corner, and she had us set pitch. She gave us basically what a patient's profile, what their allergies were, these drugs, the what we have on hand versus what the dosage is. So we had to do the calculations. It was simple stuff like, 250 milligrams of this medicine and the patient needs 500. So you go, okay, he needs 2 or something like that. Super easy as far as that, but the pressure behind it is kind of scary. And so I've been really, really lucky in the sense that I haven't put too much pressure on myself, but that was really the one thing that I was like, okay, so this is scary. So let's do it right. So that was Tuesday. And that was pretty much spent all day. We just practice. Finally, Wednesday, for the skills lab, we went in and we did feeding and nutrition. We did suctioning, what else did we do? Oxygen administration. So we had to do, nasal cannulas, oxygen masks. We did incentive spirometry. We also went back to elimination. So basically how to do enemas, how to do the correct one. Personally, I never knew there were so many. There are so many to do. So it's definitely a lot to know. And then finally, we also had to do TED hose and compression devices and stuff like that. So that was, we hooked a cohort up to all these things, and I tell you, TED hoses, whew, they are a workout. They are really hard to get up. So that was what we did in the 2 labs, skills days. And then Thursday, we actually lectured. We had lecture organ theory, and that was all about the older adult, aging adult, caring for an aging adult. And that was kind of real interesting to learn about, especially for my group, because we actually starting next Tuesday and Wednesday, we are actually going to an eschaton, and we are gonna start doing what we've learned in the hospital or in the eschaton setting. So that is really exciting. I'm looking forward to it. I definitely will make another video on that, discussing kind of my experiences and my thoughts and how that went. And we actually do that for 3 weeks. So each week I'll I'm sure the first week I'll be like, oh my God. The second week I'll be like, I got this. The third week I'll be like, oh my gosh, so easy. That's the hope. We'll see. Alright guys, so if you have any questions or anything like that for me, shoot them down below. Like this video if you do, subscribe. I'm going to come out weekly with hopefully videos of what nursing school is all about.